This is a presentation on CAR T-cell therapy for patients of Huntsman Cancer Hospital. In this presentation, we will review what is a T-cell, what is CAR T-cell therapy and how is it done? If I must stay in the hospital, what can I expect? What are the possible side effects of CAR T-cell therapy? What should I do if I have side effects after CAR T-cell therapy? Bone marrow is a soft, spongy tissue at the center of most bones. Stem cells, also known as hematopoietic cells, form in the bone marrow. Stem cells can divide many times and create new, specialized cells, including red blood cells, white blood cells, and platelets. T cells are a type of white blood cells. T cells have hooks that let them attach to cancer cells in your body and destroy them. This picture was taken through a microscope. It shows green T cells surrounding and attaching to the blue cancer cell. Cancer cells can change so the hooks on your T cells no longer attach. When that happens, your T cells can no longer destroy the cancer cells. In CAR T-cell therapy, doctors take the T cells from your body and add a new hook called a CAR to them. Together, these are called CAR T cells. You get the CAR T cells back through an infusion into a vein. The CAR T cell finds, attacks, and kills the cancer cells in your body. The bone marrow transplant team uses a process called apheresis to collect the T cells. In apheresis, your blood goes through a central line to a machine that collects only the T cells. The rest of your blood returns back to you through the central line. Apheresis is done typically over 4 to 6 hours. After apheresis, the bone marrow transplant team sends the T cells to the lab that transforms the T cells into CAR T cells. This usually takes 2 to 3 weeks. The central line is a tube that goes into a major vein in your heart. With a central line, it's easier to give you treatments like chemo, blood products, and fluids. It's also easier to draw your blood for lab tests. With a central line, you will get fewer needle sticks. You will get one type of 2 central lines. One type of central line is a tunneled venous catheter. It is a long, flexible tube that goes under the skin of your chest into a vein. The tip of the tube sits in a large vein just above your heart. The tube may have 3 lumens, separate tubes that branch out from the main catheter. Each tube has a clamp to keep it closed when it is not in use. A clear bandage covers the area where the tube comes out of your body. This bandage is airtight and watertight to keep the area clean and protected. The bandage is clear so your nurses can check for redness and infection without removing it. It should be changed every 7 days or more often if needed. Between apheresis and the CAR T-cell infusion, you may get additional treatment. For example, while your T cells are at the lab, you may get chemotherapy and/or radiation to prepare for the infusion. Low-dose chemotherapy helps to make room for the CAR T cells in your blood. Some patients stay in the hospital during infusion and recovery. Others do not have to stay in the hospital. If you stay in the hospital, the infusion happens in bed in your room. If you do not stay in the hospital, it happens in the bone marrow transplant infusion room. Before the infusion, your care team gives you medicines to prevent nausea and allergic reactions. You get your CAR T cells back through your central line. Your care team watches you closely during and after the infusion. The bone marrow transplant team will give you supportive care. The team includes doctors, nurses, social workers, and other healthcare professionals. They watch you closely to prevent infections and other complications. They will carefully measure the food and the liquid you take in. They also measure your solid and liquid waste. You will also be weighed every day. The bone marrow transplant unit has a strict visitor policy to protect you while you are at high risk for infections. The bone marrow transplant team cares for your central line and tests your blood. You are responsible for your personal cleanliness. The bone marrow transplant team will show you a mouth care routine to follow. You will also need to shower every day. You also need to wash your hands often to prevent infection. You need to exercise every day, as staying active is very important to your recovery. You need to follow the food plan that your bone marrow transplant team asks you as best you can. Please talk to your bone marrow transplant nurses if you have any needs or concerns. Speak up to the bone marrow transplant team about anything you think is not quite right. CAR T-cell therapy can have serious side effects. Your care team will watch for them, but you and your caregivers can also help. It's important that you and your caregivers know the signs of these side effects. Treating the side effects early can help you recover. Cytokine release syndrome, CRS, is the most common side effect of CAR T-cell therapy. It can happen from 1 day to 30 days after your CAR T-cell infusion. CRS may go away quickly or last weeks. Severe or life-threatening infections may happen after CAR T-cell therapy. Many of the signs are similar. If either of these happen while you are in the hospital, you may need to stay longer. If you have any of these signs after you leave the hospital, you will need to call your care team right away. Mental changes can also happen in addition to or independent of cytokine release syndrome. Signs of mental changes usually show up about 3 to 4 days after your CAR T infusion. However, they may start until as late as 23 days after infusion. The first signs of mental changes may be slight, clumsiness, forgetfulness, or urinary incontinence. You and your caregivers need to watch for signs and tell your care team right away if they happen. You will need to come to the outpatient clinic to see your care team frequently after you leave the hospital. Many things will be monitored at these visits, but one of the most important things will be the daily mini mental exam. You and your caregiver need to stay within 40 miles or 60 minutes of the hospital for the first 30 days after CAR T-cell infusion. If you have any signs of CAR T-cell therapy side effects, please call us right away. The numbers are listed on this slide below. If you have any life-threatening symptoms, please call 911 or go to the emergency department at the University of Utah Hospital in Salt Lake City. Huntsman Cancer Institute provides a holistic approach to healing and offers many supportive services. This concludes the presentation on CAR T-cell therapy. Please contact your healthcare provider with any questions.